first workshop is on the topic of empowering innovator to transform transitional care, and we have the pleasure of having our speaker today, Teemu Santonen from Laurea University, with a long experience in living labs and innovation, that will go through a fruitful presentation and best practices. And the two following workshops will be on the 4th of March, on the 11th of March, aligning innovation with healthcare stakeholder needs. And the third and last workshop will be on the regulatory frameworks, held on 18th of March. Just before I give the floor to Teemu, a brief introduction on why and how we will have this session, these webinars. The webinars are sponsored under the Evolve to Care Horizon project that is a collaborative effort to streamline experimentation in HealthTech by linking living labs and transitional care environments. It focuses on standardizing processes and improving collaboration to accelerate innovation. So, our key goals are to standardize processes for innovation testing, improve collaboration between innovators, researchers, regulators, and stakeholders, and overcome market delays or challenges by creating a shared European marketplace for experimentation. The aim is the creation of an ecosystem and framework so that innovators, researchers, regulators, and other stakeholders and users can elevate their novel ideas and advancements. We have identified some specific needs, and the workshops are based on these needs that we have identified in the beginning of the project. And on the second half of our workshop, after the keynote speech given by Teemu, we would really like to hear from your needs and indicators or challenges that you are facing as innovators, as researchers, in a more collaborative form. So we have prepared a Mentimeter session that we can build upon our discussion. So the specific needs that we have identified is transitional care improvement, improved patient. For those who are not aware, the transitional care is improved the release of a patient after a hospital or a rehabilitation center. The faster go-to-market in health tech innovations. And of course, knowledge enhancement and collaboration between innovators, regulators, healthcare providers, but also patient and caregivers. And another topic that for most researchers is a hurdle is the regulatory and cross-sectoral coordination. The multi-sectoral actually coordinated actions between innovators and regulators, and some identified areas and barriers that researchers and innovators face in the process of developing a product. So today, in our first workshop, we have the honor to have Teemu with us, that I will give the floor now. Teemu, the floor is yours. Thank you for being here with us today.
Okay, good afternoon, everybody. I will share my slides. So do you see it in presentation mode, right?
Yeah.
Okay. So I'm talking about today the role of living labs in research to business projects. And I'm using a case example, and what we are doing in the one project is testing biodegradable wearable pressure and temperature sensors with people with dementia. So just first to understand, because each time that you have a funding from certain funding instruments, that will also have an impact at what you can do and what kind of an activities are included over there. The business Finland, the Finnish kind of a governmental organization who gives funding for the companies and research organizations. So they have this very specific program called Research to Business, which is kind of targeted for the research organization to kind of commercialize the solution and the new innovations that they have been discovering during the research process. And the main idea is that, as we know, that whatever we do in the research side, it's not yet kind of a commercial solution, and that's why we need to do all kind of different activities in order to transfer research findings into the innovation. So, what in fact the commercialization includes? And this particular funding instruments, whatever we do in the project, we have to be dedicating 40% of the approved costs to the commercialization. And in the, you can see a list of activities, and in text green, I have been indicated which are typical Living Lab activities. One is like feasibility study, so kind of an understanding is this particular solution even feasible to conduct? And then the proof of relevance, is this solution relevant for the target market? You know, trying to understand what is the customer value, doing a market surveys, doing customer studies. And of course, when we are entering the market, to understanding what is the competition and what kind of a solution are already existing in the market, that's very important. And in many cases that we have to be verifying that the conceptual solution that what we are providing is valid. So often we talk about proof of concept. And then also they are allowing to do this kind of an identification of funding models and potential financiers. But for us, that's not in our target. In this particular project, we have two partners, the actual technical university and us, and they are kind of focusing on those areas. But what we do is kind of we help the projects to identify different kinds of business models. And of course, when we are innovating something new, we have to take care of the intellectual property rights. And then there are activities like identification of potential customers or financiers. And of course, when we are doing this kind of work and the researchers take part of these activities, their commercialization and entrepreneurship skills will be also enhanced. So why we are doing this particular topic, testing biodegradable wearable pressure and temperature sensors with people with dementia. As we know, the dementia is kind of a very big problem, and it's actually growing day by day because of the people are becoming more elder. And especially in Finland, this is a big problem because our, the demographic balance is in a way that we have quite a lot of the elderly people. I think Japan is the number one, and Finland is among the number two or three, or something like that. So we are a little bit ahead of the this phenomenon comparing to many other European countries. But there is kind of the people are saying that like technological support like sensors can help people with the dementia, their caregivers, in a way to allow them live longer in their homes. But in order to transfer this kind of a new solution to the market, it requires adequate and supportive infrastructure. And we think that the Living Lab can actually play a very critical and integral part in this. So in that project, we have two kind of objectives. We are doing a research and we are doing commercialization activities. The research activities focus on the designing, developing, and validating this kind of a high performance wearable pressure and temperature sensor in a way that it actually working and we can actually do the solution, which is then focusing on the health monitoring with the individual with the dementia. And the commercialization side is more about the kind of doing the comprehensive market and customer analysis alongside with the concept validation, regulatory evaluation, and in all kind of assess the commercial viability in this particular context what we are doing. So what kind of living lab activities in practice we are doing in this particular project? First of all, we are designing the research protocol and ethical application preparation. And as you might think, this is a relatively challenging situation because we have people with the dementia who are these kind of special groups. And in their situation, they are not even making a decision by themselves. So we have to be, this is a very delicate process, and there's a strict ethical rules and ethical application process to conduct this. The other thing what we are doing is state-of-the-art analysis of regarding the technology-assisted home care, especially in context of dementia, using sensors and wearables. And why we do the scientific literature review and is that we want to understand what is already known. There's quite a lot of scientific studies regarding on the, the in home care settings, either with the using different technological tools like sensors, but also many other things as well. And there's a lot of studies regarding sensors in general or wearables in general. But it's important for us to understand what is already known. For example, we know that how people are walking, we can detect what kind of memory illness they have. Just an example, but there are plenty of other things that what we can do, or we can track, that how the certain memory illness is progressing. And in addition for that, we are using the state-of-the-art analysis to identify possible user scenarios and events that we want to be detecting, like walking or how they move their hands or similar things. This solution is not yet ready, so we have to do also some basic testing. And what we are doing is that we are doing user testing with healthy individuals. The aim of that activity is that we want to be optimizing the sensor placements and verify the technical robustness in different real-life settings. For example, sensor touch comfort, like is it irritating your skin, or how does it work? If the skin gets your sweaty hands and so forth. The other important thing is, of course, the need assessment, understanding the potential user needs from people with the dementia, caregivers, the professionals, either from the nursing homes or the hospitals. In all this kind of quadruple helix understanding about what are the needs from the different stakeholders' point of view. And then we have the testing with the people with the dementia and their caregivers. And we are planning to do controlled testing and also home setting testings. And then we will be running a bunch of co-creation workshops together with these different stakeholders to refine the solution. And also the very important part for us is this kind of a regulatory evaluation to ensure the GDPR compliance, ethical responsibility, and risk mitigation. But of course, how did we end up in this point? So basically, the Technical University research team from Aalto University from Finland, they had developed and tested this new temperature and pressure sensor in lab environment. So basically, if you are familiar with the technological readiness level, it was argued that the solution is at TRL 4 level, which means that it's been tested in a lab environment. There's a couple of links to the publications that they have been published regarding this lab test. So they wanted to, they had an interest to commercialize the solutions, but of course they needed funding for it. So they were sending the application to the Business Finland, and it was rejected to a lack of proper user market research activities. And then they contacted our university and requested the collaboration. So then we did the new joint funding application where we had like a proper living lab approach included in the study, and the funding was granted. So basically, they couldn't get funding unless these living lab activities were involved. Here you can see just an examples that from these studies that they were that have been published, that what kind of things they have been doing, like for example, using the sensor to understand wrist bending or finger joints bending, smiling, knee bending, and walking, and so forth. So basically meaning that whatever happens, the pressure in the sensor increases or decreases, and based on that, it can be kind of they calculated that certain kind of a movement is happening. These pictures are quite small, but you can actually see, if you look very closely, you can see that there are a bunch of different wires already, from the sensor in a way. And of course, that means that it becomes difficult to do real-life testing in this kind of settings. So the question is that, was this solution actually in the TRL level 4 or not? In Vitalize project, that was Horizon projects to trying to harmonize the living lab practices and open the living lab research infrastructure to the researchers. And as part of that project, we also kind of identified in the activities that living labs are doing in the different TRL levels. And in that, we kind of defined this from TRL 1 to TRL 9 level activities, what we are doing. Okay, for us, it was indicated that the solutions was at the TRL level 4. So basically, it has been prototyped in the lab. But in fact, what has been happening is that only part of the solution has been tested in a lab. It's not the whole complete solution. It's not working. It's not yet TRL level. And that's why, and also, the understanding the market needs and what kind of a business concept we have, it's not existing. So basically, we could be arguing that some of the items, like the actual pressure sensor itself, might be in TRL level, but the whole actual solution is much lower, TRL 1. And there are some TRL 2, the conceptualization is existing in a way. And for each of these phases, living labs play different kinds of role. TRL 1, need assessment and ideation. That. What we do in our team, we have these two approaches, exploratory and confirmatory research. In exploratory research aim, we investigate the problem or the topic and generate new ideas and hypotheses, or we prioritize needs and ideas. And the co-creation, we investigate topic even more in detail, and we co-create and formulate concept and trying to create the value hypotheses. And often this happens in an iterative or parallel manner. And of course, in here, the similar things in confirmatory way, we are prioritizing the different approaches. And when we do a proof of concept, we explore the different human, technical, economic, environmental aspects to verify what is the best approach to develop the solution. Like, for example, what kind of regulatory restrictions there are when we are doing this solution, because we have to be transferring data from the sensors to some databases and where they are relying on what kind of a solution there are existing regarding that. And in the prototyping in lab, it's like what it says. You are doing it very controlled environment. You are doing lab testing. And then we have prototyping in relevant environment, which basically means that the environment where you are doing the testing is somehow simulating the real life experiments. For example, I was mentioning that we are doing the testing with healthy subjects. So basically that means it's partially controlled in a way that we ask them to do a certain kind of a movements, and we are tracking that, what kind of a movements they are doing. And then we are also using other technical devices to kind of record the data, which allows us to compare the new sensor data against the data from the other devices, which we know that are already working. And then when we are doing demonstration in a relevant environment, then the solution is already a little bit more mature. Basically, that means that when we are transferring the solutions to people's homes and doing certain kind of testings over there, then we are in a TRL 6 level. And TRL 7 level basically means that your solution is almost ready in a way. But in this particular project, we are not doing that. Basically, we are between TRL 5 and TRL 6, depending on how well the solution is progressing from the technical side, which we don't play any part on, doing the actual technical solution. We are just focusing on the user side of the solution. And in here, this is also outcome of the Vitalize project, which illustrates that what happens under the hood when you are doing this kind of work. On the left-hand side, you can see this kind of customer touch points. And in our case, the customer was a research group who had, on the left hand, I don't see if you see my mouse, but they had research / innovation need or idea, what they wanted to do. And also they had a funding need. So basically, what we did, the using the marketing and external communication, but in our case, they were contacting us. So somehow they knew that we were existing in a way, and they were contacting for us for that. And in order to do that, they had to do, and we have to do grant writing preparation. And there was certain call that we know that, okay, it's possible to try and funding for that. So we do the grant writing preparation, we submitted the application, and we created, get the accepted and created a consortium agreement. And then once that was done, we ended like a detailed project planning. Of course, we did a certain kind of a project planning already in the application phase, but that don't include, for example, the detailed research protocols or ethical application processes, data management planning, the getting contact with the ethical committees and so forth, or getting research site permits and so forth. And once everything is ready from project planning wise, you then actually execute the projects. And you go through these different TRLs, depending on, of course, in each project is different, depending on which phase you are entering. And for example, in this case, in this project, we were a little bit surprised that we were actually thinking that the solution was a little bit more mature. And that's why we have to a little bit change in the actual detailed project planning, we had to be changed our plans that what we are doing, and especially the schedule that when everything is happening. And then if we look these things from the Living Lab R&D services point of view, this list was also developed during the Vitalize project, which identifies and verifies that what kind of services Living Labs are offering for their customers, such as research teams or companies or whoever is using the Living Lab services. Once again, in green, we have marked the services that we actually have to be delivering during this particular project. So we do co-creation sessions, we do competition and market analysis and benchmarking, we do concept and proof of concept testing, feasibility studies. We provided them expert opinion and advisory services. We do idea selection and testing. Intake and matching basically means that they were approaching us and say that they have this and this problem, and then we were kind of saying that, okay, we can do that and we can do that, and then we agree that, okay, let's do a joint funding application together. Then we do legal regulation and safety standard support. We do marketing, sales, and networking support. We do prototype testing. We do small-scale real-life testing and experimentation. And we do stakeholder analysis. And the other thing is also Living Labs has to do a bunch of different back office services to deliver those actual R&D services what we are doing. And same thing here, we have market in green the services that we are providing. Okay, we were doing contract consortium agreements. We do data analysis, data anonymization and pseudonymization, data cleaning, data management plan, desk and market research for planning purposes, detailed project planning, ethical application preparation, grant writing, innovation network orchestration, Living Lab project management, panel management, research protocol design, resource allocation, and stakeholder engagement. And of course, public results reporting. But in this particular study, we are not probably publishing them publicly, at least not everything. Yeah. Oh, this is duplicated things. Okay, then there's just an external services which are ethical committee review process and funding application process and research size permit. So that was duplicated. And then if we look at what kind of value the Living Labs can provide for these kind of processes, this is our publications where Living Lab experts were kind of evaluating that what kind of value Living Labs can provide for these kind of projects and processes. The financial and process benefits. So basically, they wouldn't get funding unless Living Lab was involved. Improved innovation. We help them to understand that what users are actually needing, and in a way help them improve that where to put the sensors, and how to make them as good as possible. Validity and reliability, basically meaning that since we are using also other devices, we can compare the results from these pressure sensors comparing to the other sensors that what we are using. So we can validate that they are actually measuring what they are arguing to be. And benefits for the users and society. The outcome of this project should be, in a way, the solutions that can help people with the dementia or the caregivers or the caring organizations who provide services for those people. Enhanced collaboration and networking possibilities. Typically, the research teams or the technical organization who are not involved with the health and well-being before, they don't have the connections to this kind of an organizations or entities who are the actual customers. For us, because we are a very big nursing educator in Finland, so we are daily basis collaborating with this kind of an organization. We know them well, and we have good access to get in touch with them. Safe environment for R&D, we make sure that everything is done ethically. In a way, we test the solutions with the healthy people before we go to these actual target group people with dementia, to make sure that we are not bringing anything to them which is not kind of an good enough for doing that particular research. And increase skills and capabilities. Alongside we are doing this process, the research team will be also trying to getting to understand that how important the user interaction when developing the solution is. So it will be helping them to look their solution in a different viewpoint, more from the commercialization point of view and from the user point of view, instead of just looking the solution as a technical solution. Okay, this was the presentation. And just a quick marketing message as well in here. So I'm also part of the European Network of Living Labs, and I'm co-leading the harmonization working group, which is which aims to harmonize the Living Lab management practices and identify the commonalities among the Living Labs, while also embracing the differences between them. And we are publishing this harmonized living lab management practices, and the first public version should be out in very soon. And if you're interested in more about that, you should go to the ENOL's website to find more information about that. But happy to know. I don't know. Do they have questions, or how you were planning the?
I would like to. I have some questions myself that I would like to raise, but if the audience also needs some clarifications, we are happy here to answer before we go to the second section of today's meeting. So, do we have any questions for Teemu? Okay, I will ask so I can actually link the two your speech with what is happening, what will follow. Teemu, what was your biggest challenge that you faced, like when implementing these living lab innovations and as innovator to link actually with the market out there?
So this is ongoing projects, and we are quite very start of this particular process. But in a way, I would already say it in a way that normally technical, the startups and whatever, they come too late to this process. And they have solutions, and they are arguing it's working pretty well, and so forth. And then we say that, okay, users don't want this, or they would like to have this and that. They come too late. That is the most common problem. But in this particular project, we don't actually have that problem. But we have the problem that the technical solution is so low-level TRL. Like I said, it's only the sensors, and it has been tested in the laboratory. So basically, what we have to do now is that for the certain things, let's say that we put the sensors in the bed or chair or doors or something like that, we can have these kind of very bulky technological solutions with the wires and everything, and we don't have to think about that how to power it, because we can use the different kinds of solutions. But when it comes to the wearable for the human, we cannot be putting the a big the prototype to the humans, because it's not reflecting the actual user experience. And that's why I think in this particular project, the problem is that relates to that how fast we can evolve in a solution that is actually that level that we can do things that we were thinking of doing. But on the other hand, we also have a backup plan in that sense that, like I said, we can do a certain testing, like with the sensors in the bed, with the solutions that do not require wireless operation or battery power or something like that. So that I think that's probably the key challenge in here. And of course, it's always that you don't have enough money to do everything that you want to be doing. So the amount of the users in the user tests are quite limited, even though it's still quite big budget. But still, when you do everything that what we were saying to do is something that it requires quite a lot of resources in a way. So I think those are the greatest challenge at the moment.
Yeah. Thank you for your and just before we go to the KPIs and the meeting. Oh, Alexandros, I see has a question. So Alexandros, please go ahead.
Can you hear me?
Yep.
Yes.
Hello, Teemu. Thank you very much for the informative workshop. I would like to ask you, as an innovator that is involved in some innovations which are, let's say, TRL 6 or close to TRL 6, and we try to bring them to the market. As you know, Greece is a very harsh market concerning both investments but also regulatory processes and how things can move on from one step to another. What I would like to ask you is, do you have any advice as a, let's say, team of biomedical engineers trying to innovate in Greece with despite the regulatory processes that being very harsh, we also face very very huge obstacles in fundraising, because most of the big pharmas, let's say, or the accelerators that we try to get involved, fear such solutions due to the fact that um, they know how the market in Greece is. They know that we might have an 8-year, 9-year journey in front of us until we manage to get the product out there.
Yeah. And of course, most of the solutions that universities are developing, and of course, are global solution in a way. So that's first of all, is the market always has to be global market, because otherwise there are not a big enough market to get funders to be interested. But from that side, that what typically should be helping to getting funded in a way is that you are able to show that solution is actually working and there is actual market demand for that. So basically mean like what we are doing in our project in a way, to showing and identifying that what kind of what the users want, and is there a need for that, and are they willing to pay that kind of amount of the money that we think that is leading to the viable business model. So I think those are the key elements, that if you can show throughout, let's say if there's a funding increase for this kind of projects that I was explaining here today, that you could be showing that is actually working and it shows certain kind of a value for the customers, and then also at the same time showing that there is the global interest towards that. But in that sense is also the Enel has this Axela platform in a way that has been the idea behind the Enel and Vitalize project, in a way that we are opening up the living labs globally, in a way that you from Greece could be conducting a certain research also in Finland, or me as a Finnish solution developer could do in Greece or Germany or France or whatever countries there are European network of living labs, certified living labs. But of course, there is always the problem with the money. Where do we get funding to do these particular things? And that's why there should be in a long term, in a way, there should be like an lobbying activities towards the politicians in a way to allow or give funding for these kind of an activities. From other projects, what I've been doing is also that we know that the like SMEs or startups, they typically don't have much money in a way, and then in the also quite depending on if you do very extensive living lab research, it's cost and money, and somebody has to be, of course, funded it. I'm not sure if I answered to your questions, but I would be saying that show that there is a need and show that your solution, for example, in the TRL6 level, is actually working. So I think that's the best validation, because they don't believe that it's working if you say this is a concept and you don't have the data to show that it's working. You have to show it's working, and living labs can help in that.
It's not more the problem that we face to, let's say, validate or show that our project is working, more like the fear that why should we invest in a project that has a 7-year, 9-year journey in front of it until it comes to life, when we can invest in this application, let's say, that can come to life in 3 months,
Yeah. And for example, this project, that what we are doing, for that reason, we are not doing we are not targeting at the moment for the medical device. So that's why that's the big reason why we are not targeted for that at the moment.
Great, thank you. The discussion could go on, but unfortunately, we need to move on to the second session. Thank you very much, both Alexandros and Teemu, for your discussion.